this session. Today is Pudi Padwa, starting of Ramzan. So different festival, happy festival day today, remotely. So let us start with the question answer session and be fast so that I do not miss any question. Now, one of the question was there on the WhatsApp before I start, and a case also I have to show you about the case of cirrhosis of liver where the patient responded very well. It's basically under treatment now, but he has shown a very good improvement with the medicines. If I have the ultrasound, I'll tell you the reports also. The patient is much better. So everybody join in fast so that we can start it. Now once a doctor had asked me something about retarded children's. Retarded. Now see, if you are there are a lot of genetic disorders where you get some retarded children, So if you take that rubric, only a specific number of drugs will come to your repertory chart. For example, we have most of the calcareas like calcarea phos, calcarea carp, for retarded children's, brata carp, medorinum, sulfur, argentum nitricum, for retarded children. But it is very important to understand how did the patient suffer from that disease. That is very important to understand. Why did the patient get the disease? The problem lies in the pregnancy or the hereditary history. It is very important to understand. So if you are basically prescribing only for that retarded children and retarded rubric, you will only land up in about 8 to 10 remedies, which may or may not act. So in every time, make it a habit of asking why the patient suffers from disease, and then you can go to lots of remedies. For example, we have calcarea phos, calcarea carb, brata carb, which are there in the Mater Medica, and we have learned. Now we have remedies like medorinum, sulfur also, but there are some remedies which basically are not in that rubric, and this remedy also works in those cases. For example, I have seen good results with remedies like Natromur. I have used remedies like Kali Sulf. I have used remedies like DNA. These remedies basically have a very good result in those cases, and it solely depends upon the family history, the history of mother during pregnancy, whatever medications she has taken, vaccinations she has taken, and the hereditary history, the grandfather, grandmother, from which disease they are suffering from. So that hereditary chart is also very important, and then you can get into that. Otherwise, if you only take the rubric retarded children, you will only get a specific remedies, and it may not work. So let us go to some other question. Anybody? I have few questions on WhatsApp. That was I'm checking actually. Yes. So next question was on. There are some cases, which there are some personalities who basically cannot keep secrets, So we have mothers who come and tell that my child is like this. She does not keep anything to herself. Whatever we talk in the family or whatever the father and mother are talking, she tells everything to everybody. Now you can take that rubric reveals secret and all, but then don't take that, because you can take you can take the rubric idiotic child or not developed properly, and you can think about brata, but you can think of rubrics like reveals secret. In that there is a very important remedy. It is very surprising that it is there. That's hyoscyamus. Hyoscyamus is a remedy where it is written that it reveals secret. See, because in hyoscyamus, if you go to the constitution of hyoscyamus, it is written that persons of sanguine temperament, nervous and hysterical, and in delirium, it occupies the space between belladonna and stramonium. So in these cases, you will find in stramonium that he has fear of being poisoned, fear of being alone, fear of getting bitten, fear of being sold. So this is basically he has a fear of lot of suspicions of some plot. That's a very important symptom of hyoscyamus. And in hyoscyamus also, there's a symptom, reveals secret. So there are some remedies which basically have a lot of other indications, a lot of other perspective view also, but because we have only understood Alzheimer's in that part, like that hysterical part or the haughty part or the anger part, we fail to look at that part of Alzheimer's. And always remember, in Alzheimer's, bad effects of unfortunate love. That is a very, very important symptom. Bad effects of unfortunate love. Of course, there is other symptoms also, but let me at least meet all the doctors. Good afternoon, Dr. Ada, Dr. Avni, Dr. Vishaka, Dr. Babel, Dr. Sumaya, Dr. Madan, Dr. Belwalkar, Dr. Sangma, Dr. Meera, Dr. Patra, Dr. Alexandra, Dr. Sumaya, Dr. Meera, Dr. Kostu. So these basically, unfortunate love, unfortunate love is such an important, indication of Alzheimer's, such an important indication of Alzheimer's. If you go to the repertory, and you see the rubric unfortunate he feels, but in that Alzheimer's is not there. So it depends on your, it basically depends on your mathematica, mathematica and the knowledge, so that you can understand and then start thinking or prescribing the remedy. If you see in the repertory unfortunate feels, Alzheimer's is not there, but causation from unfortunate love, Alzheimer's is important. So have a very broad view of the mathematica and the repertory, because your knowledge about both the part repertory and mathematica has to be good in order to get that remedy. Okay, so just I was reading about Alzheimer's. That's what I wanted to tell you. Next, so we have a question. Your experience in treating calcified fibroid in uterus. Now, let me tell you, I had recently had 2 cases where there was calcification and it was fibrosed. Now, for the first case, which basically I would like to tell you, in that case, it was very surprising. We had did the calcium score of the patient and it was very high. The calcium score. Why did we do that? Because the patient was presenting angina-like symptoms, precordial pain, on walking there was aggravation and all. In that case, what happened, we went for the CT angio, and the CT angio, the calcium score I think was more than 1000, and the patient had menses problem also, and then we did the sonography of the uterus and we found out that there was a calcified fibroid. The only indication, the only result which we got in that case was that the fibroid did not increase, it started coming down. The patient is still under my treatment, the fibroid is much less. The calcification is there, but better than what we had before. So I'm just waiting for the report, where the report will come normal, and then maybe I'll present the case to you. Okay, so it's still under that. Of course, I have previously treated those cases with good results, and I'll show you some reports if I have. Uterine fibroid is absolutely curable, and if I have the report now, maybe okay. I don't have the report now because I'm doing it from outside. There was a big uterine fibroid, fibroid in uterus, about 18 centimeters, I think. And after treatment, it absolutely became normal. Every 2 months, we repeated the sonography, and every time we did the sonography, I think 4 USG we did, and every time it reduced from 18 to 16, then 14, then 8, then 6, and then normal. So in course of time, it gradually we cured the case. So it has definitely good role. Of course, I can tell you that every case I cure, but good results in homeopathy. So a case of AVN, yeah. So we had a very interesting case of a vascular necrosis of femur, which Dr. Meera, I think, was on the Skype clinic, and it was the first time the patient came for treatment, and we have prescribed him the medicines. And let's see how does the patient react in the next visit. I'll do the Skype clinic again, so that you get the view directly from the patient, how the patient is being treated with that. Dr. 43 years old, uterine aplasia, didn't attend Minarchy, Didn't took any homeopathy pills till now. Secondary sexual character. No one in family has this type of history. See, whatever happens in this case, okay, it's aplasia. Aplasia means there is the normal configuration of the architecture of cell has been disturbed. So my suggestion would be you have to take the whole history of the case. In this case, you cannot prescribe by just symptom, symptomatic, like fibroid is there and aplasia is there. Of course, there are some very specific remedies, but don't go by that. It may or may not give the change. Take the whole case in this case. Fantastic case of AVN showed you explain. Yeah, DNA basically what happens, there are a lot of other there are a lot of indications which are written in books which we have seen in a practice. But in DNA, one thing is very important, that it is basically I've seen in DNA cases the symptoms keep repeating in the patient. Symptoms keep repeating. The patient says that he's better, but the symptom starts coming. And in DNA, I've seen the patient is very much mentally irritable, very much aloof feeling. And in case of DNA, the patient basically wants everything to be proper order and proper, very meticulous patient wants. So this is basically what I've seen in case of DNA. Symptomatically, there are a lot of symptoms of DNA which I have not seen in my practice, so I cannot comment on that, because it's a drug which I've been recently using since the past 1.5 years. So this is the only thing which I know about DNA, which in fact, I have seen in my practice. So as I grow in my practice, I'll keep telling you symptoms of DNA. Okay. Explain indication. Yeah. External piles like bunch of grey, profuse bleeding like siphon, headache for hours together. Male 46, legs, fingers burning, high cholesterol. Please suggest remedy. Hemorrhage vascular have not helped. See, of course, you see whatever you have written in this, you have actually given the whole case. Means the patient has piles, the patient has blood pressure, the patient has cholesterol. So normally, if you look at the case, only piles remedy will not work, because it has lot of things in it. So in this case, the constitutional remedy has to be thought of. But as you have told me that bleeding piles not relating to not giving results with hemimylus and esculus. So whenever you have bleeding piles, of course, now most of us in bleeding piles do think about hemimylus, because it has all the symptoms of that. But if hemimylus is not working, write down some remedies which basically will act very well. Hemimylus, Peonia. Do think about Peonia. It's a very, very important remedy. Peonia officinalis. Second, third, phosphorus. Fourth, Kaliars. Fifth, Colonsonia. And then you can think about Allosocretina, arsenic album, carboanimalis, carbon sulfur and all. But Peonia officinalis, if you have not used it, if you have not read the remedy, do read the remedy. It is a very, very important remedy. And in Peonia, see, the most important symptom, in clinical it is hemorrhoids with ulceration. The anal orifice is purple and covered with crust. The patient, when he comes and tells you something about Peonia, he says that when he itches, there is some ulceration and something comes on the fingers, like it's a crust, and when he removes the crust, that's the ulceration is there, fissure is there, and it is very painful. It is the evacuation is very painful. It is followed by burning and biting. A patient of Peonia will always tell you biting pain, biting, burning, and that is Peonia. So do think about these remedies, Peonia, that is very, very important in this type of cases. And of course, I have told you some remedies which are very, very important, like phosphorus is there, Peonia is there, Kaliars is there, Colonsonia is there, then Allosocretina, arsenic album, these remedies are there. But then you have to understand and see when hemorrhoids, aggression in the morning there, aggression waking up there, or hemorrhoids is with backache, without backache. Because if hemorrhoids is with backache, do think about, with esculus, think about noxomic and belladonna also. So these are the very important symptoms. Like then if it has become very chronic in nature, then think about colosonia, sulfur, noxomica. If it is very congested, then think about the remedies. If it is with constipation, then think about some other remedies. And so see, there are a lot of other symptoms that you have to take care when you're treating hemorrhoids, because Only Aesculus and Hemimulus sometimes will not help you. Of course, in any case of hemorrhoids, if you don't understand anything, Hemimulus will give you some results, but then for long-term effect, it has to be taken in a grand symptom. Grand symptoms have to be taken. Good morning, Dr. Kochar, Dr. Kaustubh, Dr. Bawa. IBS, yeah, IBS basically, again, I would tell you, irritable bowel syndrome is a very, very important condition, and it's a very difficult condition to treat because irritation is here. And whenever irritation is there, so it becomes very important in case of irritable bowel syndrome to start prescribing in the because of irritation in the mind. That is very important. That is very important because sometimes what happens that in irritable bowel syndrome, the patient comes and tells you that my color of stool is black, my color of stool is frothy, it is foul, it is bluish, it is green, it is, you can name the colors and they have all the colors. Of course, if it is out of control, syphilitic, do take, but irritable bowel syndrome, the name itself suggests irritable bowel syndrome. So irritation has to be here. But a lot of people have asked me this question and then they tell me to compare remedies in relation to stools. Whenever an irritable bowel syndrome patient comes to the stool is suppose black in color. Few remedies are very, very important. The first remedy is Leptendra. Don't miss out Leptendra if the stools is black in color. Then you can think about arsenic album, then opium, then colonsonium, then mercury. When the stool is black in color. Sometimes the patient says the stool is brown in color. Then you can think about Veratrum, Merxol, Argentum nitricum, and Lycopodium. Sometimes the patient comes and tell you that the stool is like clay, clay. Wherever the patient comes and tells you the stool is clay colored, two remedies are very, very important. The first remedy, if you don't understand the case and the patient tells the stool is clay colored, do think about Cardosmar first, second Podophyllum, third phosphoric acid. But if the stool is clay colored in jaundice, don't give Cardosmar, then give Podophyllum. Stools green in color, think about Gratiola, Gambogia, Croton tick. These are rare remedies. Of course, sulfur, phosphorus, ipecac is there. But Gambogia, Gratiola, these are rare. Croton tick are remedies. The stool is green in color. So in this case, you have to basically decide on the color of stools also you can prescribe, but not necessary that every patient just by seeing the color of the stools can be cured. Mind is very important to understand. Okay. There are a lot of questions. Persons having lymphadenopathy in the upper jaw area, 70 years, no other complications. Person is hot in nature, hardly catches cold and cough. Yeah, so in this case, what happens? Lymphadenopathy, patient has no symptom. Do think about anacardium, calcarea carp, brattacarp, argentum nitricum, and alumina. Can scrofloria and thuja help in case of any other medicine? Yeah, if the remedy is indicated, any remedy should help. That's what I feel. I don't know the exact question, but whatever remedy is there, it should help. If the symptom matches, then basically it should help. So as we go further, which questions? Sulfur consistency. If you basically ask a remedies a particular symptom, especially sulfur, now a sulfur patient, if you see if sulfur maybe has everything, you name it. For example, if a patient comes to you with stools are different type of colors, sulfur would be there in most of the remedies. For example, if you say the stools are dark in color, sulfur would be there as a 2 mark or 1 mark. But if you ask me, looking for sulfur in case of IBS, sulfur stools are dark. I have seen in most of the cases sulfur are dark in color, and I would go one step further. In sulfur patients, I have seen the stools are more green in color. So whenever if you are finding that the stools are green in color, you must first think about sulfur. In homeopathy, there are so many different type of colors. If you open the repertory or the Mathematica, reddish color, saffron color, several colors, slate colors. But sulfur, if you ask me, so do look about the green color or the dark colored stools. Those are sulfur personality. Of course, As I've told you before, sulfur will be there in all the colors, either 2 marking or 1 marking, because it's such a polycrest, it's such a beautifully, and it's exhaustive proving. It just covers everything, like I always say, the Kent's Metermedica. Read Kent's Metermedica, and it is written that the good prescribers and the bad prescribers, the difference is only sulfur. Persons lymphatic sulfur constitution we have through sulfur are soft pasty stools and hard stools also. A chronic case like tumor, in your experience, where a remedy acts, do you stick with the same remedy until cure, or usually you need to change the remedy? Burnett is always changing. Yeah, I cannot comment on Dr. Burnett. He's much higher and much greater than maybe me, for me. But whatever cases I've cured in my life, right from cases of brain tumors to neurocystic sarcosis to benign tumors of the breast, fibrocystic disorders, simple case of fibroadenoma, simple case of lymphadenopathy. If one remedy starts working, I have seen that remedy cures the case. I have not changed the prescription in that case, except only when the acute phase of the patient comes, or in indisposition phase of the patient comes, and the patient is in need of the medicine. In that case, I would give an acute medicine in relation to the chronic medicine I've given to the patient. But if the case is working, I would not change the medicine. I had a case of bilateral axillary abscess. Doctor advised him to operate, but he didn't want to it. What should I give? Bilateral axillary abscess, you're talking about the abscess. That means make sure if the abscess breaks outside, so that the fluid comes out. In this, do take the symptom, whether it is painful or painless, whether it is hard or soft or semi-soft, and whether it is causing any complaints to the patient. For example, pain is there, redness is there. So if an acute symptom is there, there's redness and pain is there. If you want to burst the abscess, think about belladonna. If it's on the verge of if it's on the verge of just breaking it, think of calcarea sulf, think of silicia. And sometimes if you feel, a lot of doctors think that if it is not working, then you can start the patient giving silicia LM potency, and gradually it will take off that. But if it is a foreign body cause, if the cause is inside, then it is and not responding to any treatment, and it is bilateral and very what you call small abscess type, then basically think about remedies like Phytoleca, Hipasulf, Conium, and calcarea floor. Mild symptoms, I mean, some mind symptoms. Just a minute, some questions I have. Yeah, very suspicious about every person that are making plans about him. Okay, working for religious academy before intelligent, so girl that doesn't like her, jealousy of her, blames her. Now, see, if a person has that feeling that somebody is very suspicious, or somebody is doing plot, now there are remedies, in a Mathemedica, those are very suspicious remedies. Of course, everybody will think first remedy should be lachesis. Of course, that's right. But there are remedies which I have seen much better working than lachesis. Do think about remedies. Lachesis is there, Lycopodium, Causticum, Sulfur, Cicuta, Sickle, and Rustox is also a remedy, where this suspicious is there. But I would like to go more further and just tell you that do think very the suspiciousness. Sometimes the person is suspicious and he does not want to be in the company of anybody. He wants to be alone. Then natrum carb is there. And some persons they are suspicious about everyone. Then is censorious, the remedy is there. Then some persons are very suspicious toward the family. They feel that family will do something else to them. Then the remedies are sulflamum. Always suspicious about family, and always suspicious about friend, that is Kaliars. So there are different type of suspiciousness, and then of course there are remedies where there is a delusion that everybody is my enemy. Then the remedy changes. Then you have to think about mercury, pulsatilla, and platina. Or sometimes the patient says that he is being persuaded, delusion pursued his enemies by, means he feels that he is pursued by the enemies. He is pursued by the enemies. Then the remedy changes. Then it becomes anacardium, belladonna, China, pulsatilla, and one rare remedy that you should remember is cocacin. C-O-C-A-I-N. Cocaine. Mild symptoms of IBS in your experience. See, the first symptom that you have to think about in IBS, irritability. Now, this irritability will start from sora. This irritability starts from sora. For example, you have magnesium carb irritability. The problem is orphanage child. You have phosphorus irritability, disappointment somewhere maybe love XYZ. Then you have platinum irritability. Her ego has been hurt, the esteem has been hurt, then platinum. The noxomic irritability wants everything fast, but cannot complete or has the work not done properly, then the irritability. Then we have the natrum irritability, which are very irritable personalities. Somebody has offended him, lot of brooding, but cannot take the revenge, that irritability. So this irritability, the irritation part has to be taken care of, that is sora. But normally what happens if you don't know where the irritation has started? Because the patient has forgotten or the patient feels that is normal, so what to tell the doctor? That's when we miss the plot. The irritation has to be there, and there are so many cases in my practice which I have not treated, cured in case of IBS. I have lots of cases, and in most of the cases I have seen this irritability, very important in my practice. Dream of cats flying and attacking her when she woke up and she has severe pain in legs. Thought she's popular. Modi ji calls her. A status of WhatsApp also seen answering her. Basically, make sure that the patient is not suffering from a bipolar disorder or schizophrenia, but this is called as grandeur. No? Everything great grandeur. So you can go there and get your remedy. Child 3.5 years, constipation, thick, hard and large stools, very painful. Child fear to be touched as needed. It has to be removed mechanically. Child protruding the tongue. So I think everybody can answer this question. We have very good remedies, and to be very honest in answering this question, if basically Dr. Madan, if you are taking a 3.5-year-old child, so in a 3-year-old child, constipation, you must think about remedies. First is calcarea carb, second is nux vomica, third is silicia, fourth is thuja, and fifth is you can then have remedies like graphitis, you can have plumbum, you can have creosote also. But do think about remedies like calcarea carb, nux vomica, alumina, silicia, thuja. Antim crude gave me very good results on eczema with clay stools also. Okay, fine. No, we have, and see, there are a lot of remedies for clay stools. I just told you something about cardusmar, which is there, and I told this in cardusmar because if you in jaundice, if the stools are not clay, if the stools are clay colored, then you have to think about the remedy podophyllum. That's why I was telling you about cardusmar, but clay colors too, lot of remedies have it. Child seems sympathetic, smiling, helping to medicate if hurted. Think about calcarea, think about alumina, think about natrum also, and you should be able to get your. So the experience fistula and its comparative or how to deal with fistula. I think this maybe I have done in my YouTube live or somewhere I have done in fistula, but still I'll talk something about fistula. Generally, see, if you have fistula, so don't always prescribe on the pus and the pain because that's quite normal in the acute stage. First of all, generalized remedy for fistula, you must remember nitric acid, silicia, causticum, calcarea, both the calcareas, calcarea carb also and calcarea phos also, kalicar. These are very, very important remedies in case of fistula. And if there is a case of fistula, the patient comes and tells you that the discharge is very offensive, and in that case, I have got very good results with calendula LM potency. Calendula LM potency have given me good results, though in the mathematics of calendula it is not given. But whenever I have found that the fistula is super infected and the patient has fever and there is a lot of foul discharge, calendula and LM potency with repetition has given me good results. And then you have to think about when is the fistula and what are the concomitant with fistula. For example, in some cases, the fistula is always present with a lot of itching. The patient says, I'm itching, and because of fistula, the clothes become dirty and the hands become dirty. It's very offensive. Then think of a very, very rare remedy. That remedy you must have thought in case of colic, or you try or stones, kidney stones. That is Berberis vulgaris. Some cases have fistula which are after the operation. So don't think about ledum pala staphylococcus aureus, but fistula after operation is calcarea fos. Some cases come with fistula with a lot of palpitation. They say, Dr. Saab, whenever I have this fistula pain, there is a lot of ghavrat, palpitation. Then think about cactus grandiflorus. And sometimes the fistula is also painful. The patient comes and tells you, I have pain in the fistula as if lap lap karta hai. In Hindi it is called throbbing. It's like pulsating pain. Then think about causticum. So these are different remedies and different indications of remedies in case of fistula. Do you have nosodes in LM potency? Yeah, we have. I have. Though I have not used nosodes in LM potency, I'm using thyroidinum lots in my practice. But nosodes, medorinum, though I have used very, very sparingly medorinum and all, sorinum and all, but I have in LM potency. So if questions have scrolled up, you can keep asking again. Can basically what happens, now fistula was an important question. If I go further and try to answer this question, there is a very important remedy, when there is fistula in the perineum. Which is the remedy can I think about? Fistula in the perineum. Which remedy comes to your mind? Anybody? That's a question for you all. So give you carcinosin, etc. and nosodes too. Yeah, I've given carcinosin to a lot of cases. I've got good results, carcinosin. Yeah, I've given. Patient 79 years of before stools. Yeah, when the fistula is very, very painful. Now, if the fistula is very, very painful, you must think about remedies of pain, and you'll be surprised that if you start prescribing Berberis vulgaris, then you should get very good results. Berberis vulgaris I have seen will give you very good results. First remedy. Second, think about fluoric acid. And third, think about syphilinum. These three remedies I have got very good results in my practice, but it is very much, no, fistula in the perineum is not a Maxol. 79 years, so suspicious, the daughter took the key of the locker, thinking and accusing she will not give it back the key, and she takes all the money. She's thinking the people are talking behind her. So I've told you a lot of remedies, people are talking about, and there are a lot of just this. If you want to prescribe on this, I can tell you the remedies also. You can think of remedies like I told you, Lycopodium is there, Lachesis is there, Kalias is there, Pulsatilla, Causticum, Brata, Anacardium, Rustox. These are remedies. But sometimes I was just giving you, I told you that everybody feels that everybody is an enemy, or then the remedy changes, and sometimes the patient feels if he has a delusion as if he is pursued by enemy. Uske matlab somebody is always making plans and all. So in that case, do think about, I told you, think about Pulsatilla, Belladonna, China, Lachesis, and the rare remedy, cocaine, COCAIN. Fistula with pain have finished. Maxal, no. You have to think about remedy where the fistula is in the perineum. It is as good as a very important and a specific remedy for fistula in the perineum. So if you get a case where there is fistula in the perineum, do think about that remedy. Or if you do not get the consultation remedy, you can give this remedy and you will get good results. Which is that remedy? It is not Maxwell. Anything else? Anybody? Fistula in the perineum. Are there no answers? Whenever there is a fistula in the perineum, one remedy is very, very important, and sometimes it becomes almost the specific for that case. Anybody? So we have a case of this is actually a case of cirrhosis of liver. It is not still cured, but much better with the treatment. LFT have come to normal. So the size of the liver has reduced, but it's still there. But the patient is responding well. The ascites has been cured. That is important in this case. So I was just going to share that case, but let me cure that case first. So no answers. So the fistula and the perineum, there is one remedy which is very important that you should think about, and that is you can keep guessing and trying. I'll give you the answer when I answer these two questions. If patient always complains about जी घबराहट है हमेशा, 60 years old patient also having diabetes and is on diabetic medicine in spite of well eating, what should I think? Yeah, so there is a condition, where the patient always has this problem of anxiety. This is called as generalized anxiety disorder. First of all, you have to basically understand why the anxiety is there and try to treat the cause. In this case, sometimes you ask the patient when is the anxiety more, and he will say, whenever I wake up in the morning, I have anxiety. So whenever the patient wakes up in the morning and there's a lot of anxiety, what to do, think about arsenic, graphitis, phosphorus. But there are some patients who, whenever they get up after sleep, maybe morning, evening or night, they have anxiety. Graphitis, lachesis, phosphorus, naxomita. Some ladies basically have always anxiety before menses. Then think about ammonium carb. Or there are some cases who come and tell you कि दिन भर तो मेरा डॉक्टर साहब अच्छा जाता है, but जैसी शाम होती है, whenever evening starts, I feeling anxiety and panicky. Then you have remedies like arsenic is there, calcareous carb is there, nitric acid is there, CPI is there, sulfur is there. Then if you try to ask the patient what time in the evening, and see in the mater medica, then the timings are also written. Anxiety at 7 p.m. like we have remedies Drosera, muriatic acid, petroleum. Or you had anxiety at 8 p.m. then we have again the same remedies. Sometimes the patient comes and tells you, whenever I go to bed or whenever I have to sleep in the night, I start becoming anxious. Then think about ambragrasia, sulfabum and carboage. Sometimes the anxiety is so severe, the patient cannot breathe because of anxiety. Which remedy you should think about? When the anxiety is too much, the patient cannot breathe. Can anybody give me the answer? Anxiety is so severe, there is a lot of oppression of breathing because of anxiety. Then you have to only think about one remedy, and that is keep guessing. Sir, one patient of mine suffering from IBS seeks attention from husband and says husband may be sad or angry because she is never well. She needs care and is better if someone cares for her needs. Yeah. So what happens, Dr. Sangma? Now you are telling symptoms that a patient is already an IBS patient, and she feels that the husband would feel that she's always diseased and I have to take care of her. This is now after she has been diseased. Why she has become IBS? If this is the case, then maybe she wants to please everybody at one time, or maybe she wants to cook good food, but she cannot. She wants to dress up, but she cannot. She wants to do this, but she cannot. She cannot please anyone or husband, and she becomes irritated because of that. And because of that irritation, develops IBS. And the same feeling in IBS she has now. I'm diseased. Now I have so much problem, and she feels guilty that husband has to take care of her. So ask the Sora first, how is the Sora, and then you can come and have these type of indications. Calcaria and Thuja. Now, whenever you have fistula in the perineum, the most important remedy that I have used in my practice, almost a specific, is Thuja. Well said, Dr. Alexandra. And respiration is anxiety so too much that there is operation in the patient cannot breathe. It's so much anxiety. It is not arsenic or kalias. If left-sided axillary abscess from 7 years operated before painful yellowish pus continual discharge straight forward nature having depression of 5 years. Now basically basically what happens if the patient is in depression, so there is pus because of that, and whenever the pus is there, the patient takes the medicine or takes some antibiotic, the pus is better, again it forms, again there is pus. So it is basically a case of vicious cycle. The patient gets relieved by having this pus because it's an elimination, it's a discharge. Of course, if the pus is very thick, think about silicia. If the pus is thin and offensive, think about calcareous sulf, think about myristic, or there are lots and lots of remedies. But if it is left-sided, operated, and because of depression for 5 years, so this case it is very important that the pus symptom matches with the state of the mind. Now, depression is a very grand rubric, a grand symptom. It has lots of things, but that has to match with that discharge of pus. That is important. Berberis, myristica, arsenic, and Kaliars. No. Whenever there is too much of anxiety followed by oppressed in respiration, the first remedy that you should always think, डॉक्टर साहब मुझे इतनी घबराहट हो रही है, आई एम फीलिंग सो एंशियस, what will happen, what will happen, what will happen, and she starts panting, breathing, and you feel that, oh my god, she'll collapse and she has to be taken to the hospital and I think there's a heart problem. In that case, think about only one remedy that is not arsenic, that is carbo-veg. That is carbo-veg. 31-year-old patient of lupus, while urination first 25% urine has burning sensation and yellowish, 70% has no. Yeah, so this is a very this becomes a very important symptom, that the patient suffers from burning in the first part of urination. So you think about remedies. First you think about thuja, second think about mercor, third think about cubeba, and fourth you can think about, again, now this is again a very rare remedy, I don't know if used or not, petroselenium. That IBS patient needs attention but is neglected, and husband thinks she is fine though she knows she's unwell and has to spend most of the time alone. No, so Dr. Sarma, the most important thing in your case, now you are giving symptom that after that the wife is feeling that way. What was the sora? Was the patient timid? Was the patient irritated because she could not do something which she wanted so much to do in life but she could not do that? Or if the patient does everything life right but still she is diseased, then also irritation can happen. In both the cases, in this case you have to understand. That is important. I will get the case, but still if you find that you are not getting the results, you can WhatsApp me the whole case and I'll try to figure out a remedy maybe. Okay. Any results with the nosode which I sent you? Anybody who has used that COVID-19 nosode and got some results in your practice, do share your experience. I am basically sharing my experience. I have got very good results, but you also should get some results so that we also basically can hear some good results and understand and learn from your results also. Yeah, Kali Carb also has extreme anxiety. Very well said. Kali Carb has got extreme anxiety, and if you see the Mathematica anxiety, anxiety basically is a very, very grand rubric. And anxiety basically has to be then defined. Okay, when the anxiety is more, or after anxiety, what happens, and there are a lot of other symptoms you have to take about anxiety, because anxiety, if you take a simple rubric, you open the repertory and you get so many remedies for anxiety. Then different anxiety in the morning, in the night, in the evening, or anxiety in the bed, anxiety. There are a lot of other combination. Oh, very nice. So very nice. You have used the COVID nosode and it is working. So that is so important. That the patient are nice. It's very important. It's very nice, and thank you for sharing your experience, so that whenever I am making a medicine or giving something new to the patient, that I always share with that. and see, making a nosode and then publishing it and then recognizing it takes a lot of time. So basically I wanted the most nosode to make, because I have a factory, send it to people, give it to the people, and so the results are there. So it's very nice you have shared your results. Thank you so much. Lingering cough after severe chest infection, paroxysm is expected, which is to be swallowed. Uh, yeah, lingering cough after severe chest infection. Lingering cough after severe chest infection, do think about remedies, ammonium carb, sorinum, and one remedy that you should always think about whenever the chest infection keep lingering after anything. If the chest infection are always there, think about phosphorus. Phosphorus. I took the nosode, but not your nosode. I got all SX again, and after, okay, aplastic anemia after. Oh, aplastic anemia after acute illness would be a very interesting case, but see, aplastic anemia, if you see aplastic anemia, when the body stops producing new cells. In acute condition, ferrum metallicum, ferrum metallicum works wonderfully. But in that aplastic anemia, second important thing is that because of that, the patient gets fatigued, tired more, and is prone to infection and uncontrolled bleeding. So this is very important, that if you give a constitutional remedy, the recurrent infection pattern is then stopped, and the body and the constitution gets time to develop that part, and then you can give the patient results. But ferrum metallicum should give you good results, aplastic anemia. Next time, if possible, do send it. Yeah, and dilution I cannot send, because in Korea you cannot send the dilution, so I have to send globules only. Okay. Anaplastic anemia, Dr. Anup, make sure in case of anaplastic anemia, you take the whole case. See, acute medicine would help like for some time, but then it will stop, keep acting, and you have to increase the potency gradually and it will stop acting. But in aplastic anemia, ferrum metallicum is given, do give that case, or ferrum phos, do give that in LM potency, so that repetition you can give and it will give results without any effect of side effects and fast. That's important. The symptom of fatigue in case of aplastic anemia is taken care of very fast if the LM potency is given. The constitution is arsal phlegm of the lingering cough, which remains after 6 weeks. Okay. So if the cough is disturbing the patient, then only give the medicine. See, if the cough is not disturbing the patient, I think you should wait. Because if arsal phlegm is the remedy, don't disturb the remedy unless the cough is disturbing the patient, that it is hampering the life of the patient not able to sleep properly, or if that is there. And if it is not there, then I think you should wait. You should wait, not give any medicines. See, problem among when wake up very sad, anxiety for day, and yeah. So I told you, I would not repeat the constitution medicine. I'll wait for some time more for arsal phlegm, and if it does not go, I would in spite either giving other medicine very close to arsal phlegm. I would first give arsal phlegm basically in the same potency and repeat once, and then see if it does not work. Then maybe a very close remedy depending on the type of cough, then prescribe the medicine rather than ask. I would not change the medicine. So we have anxiety in the morning when he wakes up, and there is a lot of anxiety in the morning. So as I told you, whenever the patient wakes up in the morning and he feels, oh my God, now morning has occurred, now again I have to live the whole day, and what will I do? So he gets up with that. No, he's not happy with the day. He's not happy in the morning. In that case, there are few remedies which are very, very important, and you should think about that remedies, because in the morning, after a good night's sleep, still you're not happy. If you're not happy, then there are some remedies which basically, I would give the name of the remedy. There are a lot of remedies, but I will only give the very important remedies. First, think about phosphorus. Second, think about lachesis. Third, think about arsenic album. These patients, whenever they wake up in the morning, they have anxiety. In fact, anacardium is a remedy when he just opens the eyes in the bed when he's sleeping, he starts getting anxiety. Anacardium. And some patients, basically, if you ask me the other part, whenever the patient has anxiety in the morning, and when he wakes up in the morning, he feels much better. That is also very important. In the morning, anxiety is much better. Then think about fluoric acid, Nux omega, Rus toxin sepia. Okay, so these are the various, both parts you have to know. Experience in hemoglobin E trait and how you treat. Experience in hemoglobin E trait. E trait means I don't know, and how to treat that. I did not get your question, Dr. Sama. E trait, I don't know exactly. See, and one part I would like to tell you, if the problem is in the hemoglobin is not rising. So whichever acute medicine you give, the blood is not going to rise because the whole constitution has a problem. No, there's a problem in the bone marrow, or there's a problem in a lot of bleeding is there, or there's something which is not letting the hemoglobin come up. So first take care of the primary cause. But still, if everything is normal, still the HB is not rising, then you have to take the whole case into consideration. Just acute medicine does not help in increasing the hemoglobin because it is basically a problem in the whole constitution and not a particular problem. For example, when you have a case where there is weakness, prostration, exhaustion because of grief, and the hemoglobin goes down, then you have remedies like ignitia, acid phos, nitramur. So if you open the mater medica, it is not specific, but there's a specific cause, that the HB is low because of grief and all, then you can see these remedies, So in that way, you have to basically, in these cases, take the whole case and understand the case rather than just giving the medicine. And you'll be surprised to know that there is a remedy called hemoglobin only. There's a remedy called hemoglobin, prepared from hemoglobin only. And I have that remedy in LM potencies. I'd called that. And the symptom was written that increased hemoglobin, but in that case I did not get any results. So I normally don't give the specific remedies prepared from that only because it does not give me the results. I try to use that remedy in case of sickling and thalassemia because HB goes down very drastically down. So, but it did not work. So you have to basically take the whole case and then get to the remedy. That's important. HB trait, okay. Yeah, so see, it's basically if the trait is there, that means she's got from the family. So ask the hereditary history, the pregnancy history, everything. In those cases, continue folic acid, and if you can hit the minimum, automatically you can taper down the folic acid. I have few cases of sickling where the HB was absolutely 7 and 8, and the patient used to get a lot of pain in the joints, recurrent fevers, recurrent cough, liver, recurrent lymph nodes. But now after 1 or 2 years of treatment, he's with me. The HB is 11, 12 with no fevers, no pain, nothing is there. But still, the report shows that she is sickling or thalassemia, but no symptoms whatsoever about that disease. So you can say absolutely the patient is doing well with a constitutional medicine. King Alex, sir, insomnia, late night sleep, 3-4 a.m., full day drowsy and sleepiness, no energy, chronic case for 5 years, no specific reason. Oh, see, basically, sleeplessness without cause, would be such an interesting thing, Sleeplessness, मतलब कोई cause ही नहीं नींद नहीं आने का. So I always say that there has to be some cause for sleeplessness, although there are remedies where there is no cause for sleeplessness. So you can write down the remedies. Those remedies basically are, I have seen in my practice, carcinosin, sulfur, one more remedy, aurum metallicum, mercury, and maccarb. These are 4 or 5 remedies which I have seen where there is no cause of sleeplessness and the patient still has a problem of sleeplessness. So carcinosin, maccarb, mercury, sulfur, these are very common remedies which I have used in my practice. But I always want always have one reason, that there has to be some reason for a cause. You can't get a disease without any cause. Good afternoon मिश्रा जी, I am too late, sorry. ठीक है, कोई बात नहीं. Mom's HB is 10.6, very nice. And yeah, I know the case, Dr. Nojut, and she's doing very well with the medicine. That's fantastic, because I think we have taken the whole case, Nojut, and then I have prescribed the remedy. I have not given any specific remedy to her mother, so it's good that the patient is improving. Nice. So I hope today's most of the questions I tried to answer, and you got the answer for the question. So thank you for your patience hearing, and meet you on the next YouTube live next Saturday. Thank you so much.